Welcome back. Now remember, in life there are two types of arthritis. There's the osteoarthritis, which is the mother nature, happens in everybody, very, very common. And then there is the autoimmune arthritis, such as rheumatoid arthritis. It is not that common. In fact, if you take 1,000 people and you put them in a room and you watch them for 1 year, only one person gets it. And this is where the immune system is overactive and now it's attacking the body instead of protecting it. When it comes to the rheumatoid joint, it is a different type of arthritic joint. Normally, arthritis will happen in the middle of the joint. For example, if you have the bone from above and the bone from below in a joint, and you have the joint space in between with the cartilage, over time, that cartilage wears away and the joint space gets narrow and more narrow. Whereas in rheumatoid arthritis, the problem is more at the side, which is where the synovial lining or the lining of the joint lives, because that's where all the immune cells can go in. And so basically the joint gets eaten from the outside in. It causes a lot of warmth, pain, and swelling, and that combination is called synovitis. If that happens long enough, it can actually cause permanent damage, which is then known as deformities. The risk factors of rheumatoid arthritis, just like everything else, it can run in families, so it can be genetics. It can also happen more in women, usually around the ages of 40s to 60s, but also smoking, because that makes sense, right? The immune system becomes irritated when people keep smoking, and it'll keep doing this and this and this, and at some point it'll go up and not come back down. When it comes to the diagnosis of rheumatoid arthritis, the most important part is a good history and physical, meaning that what the patient is describing isn't matching up with what we see on their bodies. In patients with rheumatoid arthritis, the number one thing they complain of is stiffness in the morning. And it's very profound stiffness in the morning, meaning that it lasts a few hours, sometimes even half the day or all day. And patients will often describe to me that they have to set their alarm maybe an hour earlier before they go and get ready to do something just to unstiffen so they can do that. The other part of it is synovitis, like we learned. It has to be that combination of pain, swelling, and warmth, and it has to be in more than 4 joints. The next part is symmetric. It has to be on both sides of the body, so both hands, both wrists, both elbows, etc. It has to be for more than 6 weeks because weather can come and go, other changes can come and go, but rheumatoid arthritis will usually come and stay. And finally, which I think is probably the most important part of the diagnosis, is to rule out other things that can give patients the same symptoms, such as certain infections, especially viruses, certain medications, and certain diseases like thyroid disease, etc. And at the very end of this process is checking labs to either help make the diagnosis or to help confirm it, and even further down are other testing such as x-rays and scans, etc. The reason this whole process is so long and sometimes time intensive is because diagnosing rheumatoid arthritis correctly and responsibly is very important, because remember how we treat all autoimmune diseases. We push that immune system down and the disease goes into remission. However, whenever you push a patient's immune system down, you put them at risk for infection and cancer. So we are going to end here for today, but there's definitely more to come. Until next time.